Hello students, welcome home to Mars. Today we are going to start with the first topic of head and neck, that is midline structures. So, where are these midline structures? It extends from symphysis menti. So, you know what is symphysis menti? This region is symphysis menti. So, from the lower border of symphysis menti to the jugular notch, or you call this as suprasternal notch. Now, why are we studying midline structures? In my experience, I would consider it for two reasons. The first reason is, before you attempt to study any other part of head and neck, be it your triangles like anterior triangle, or be it the thyroid gland or the muscles, always attempt to study the midline structure that will help you to understand the relations better. The second reason for which you have to study the midline structure is for clinical correlation. See over here, you can see a midline swelling here. You can see tracheostomy done over here. So the clinical correlation is, we are studying midline structures for two very important reasons. First is to diagnose or to differentiate midline swellings, and second thing, to perform tracheostomy. Now the second thing, how to approach midline structure. Let us think like a surgeon. What is the first thing we have to remove to observe the midline structure? Of course, the first thing has to be the skin. So remove skin. There's nothing more characteristic over here. Once you remove the skin, the second thing that is in the midline is the superficial fascia. This is superficial fascia. This superficial fascia has very important structures which you should identify today itself. The first structure is this muscle over here. This muscle is platysma, which covers partly the midline structure over here. So apart from platysma, we also have these veins over here in the midline. They are slightly on either side of the midline. These are anterior jugular veins. Also in the superficial fascia, we have these nerves. These are cutaneous nerves. So superficial fascia contains platysma, anterior jugular veins, cutaneous nerves, and also lot of fat. Once we remove the superficial fascia with all these structures, we can see on this side of the picture, you can see this blurred structure over here. This is the deep cervical fascia over here. So this is deep cervical fascia. Once the deep cervical fascia is removed, on either side of the midline, this is the midline, on either side of the midline, we have these muscles. These muscles, which are otherwise called as strap muscles, which are just beneath the hyoid bone, these muscles require to be slightly retracted so that we can see the midline viscera, the structures very clearly. So these muscles are infra-hyoid muscles. Once these muscles are exposed, then we'll be able to see the midline structures very clearly from your symphysis menti till the jugular notch. So now that you have seen how to expose the midline structures, as a revision, first remove the skin. Just beneath the skin is superficial fascia, which contains platysma, fat, anterior jugular vein, cutaneous nerve, and some lymphatics. Then comes the deep fascia. Remove the deep fascia, you will see the strap muscles on either side of the midline, and just retract them, you will be able to see the midline structures. Now we can better understand this by drawing a simple diagram. So please start with me. Midline structures of the neck. Midline structures of neck. So first we shall draw the 2 points. So which are the 2 points? Symphysis menti and jugular notch. So let us first start with symphysis menti. So draw like this. This is one half of the body of the mandible. This is other half of the body of the mandible. So we are only interested in symphysis menti. So label this part as symphysis menti. Now come straight down and we shall draw the jugular notch. So ensure that you're vertically down here. This is the jugular notch. This facet is for clavicle. This is for first costal cartilage. This is for second costal cartilage, and this is the joint. So this part is manubrium sterni, that is the upper part of the sternum, and this notch is jugular notch. You're aware, jugular notch is otherwise called as suprasternal notch. So now we have drawn 2 points which connects the midline. What is the next thing to be drawn? So around 1 centimeter below symphysis menti and 6 centimeter behind. So you can see my chin is protruding here. So I'm just coming 1 centimeter down and 6 centimeter behind is our hyoid bone. Hyoid bone is the only bone in the body which does not articulate with any other bone, but it is suspended over here by ligaments and muscles. So look at the structure of the hyoid bone. This is the body of the hyoid bone. This is lesser cornua and this is greater cornua. So this is the hyoid bone. So we'll label this as hyoid bone, which lies approximately at the level of C3 vertebrae. Now, from symphysis menti to the body of the hyoid bone, draw one fibrous raphe like this. We'll label this as fibrous raphe. Now, the muscle which is called as mylohyoid muscle from either side is attached partly to this fibrous raphe and partly to the hyoid bone like this. So this is mylohyoid muscle which forms like a diaphragm over here. So it is otherwise called as diaphragma oris. So we'll label mylohyoid muscle here. Mylohyoid muscle over here. Also, remember it by the name diaphragma oris. So, just beneath your symphysis menti, if you just touch like this, just remove skin, superficial fascia, deep fascia, and then you will find this mylohyoid muscle with the fibrous raphe in the middle. On this mylohyoid muscle lies the lymph nodes. These lymph nodes are called as submental lymph nodes. These lymph nodes are called as submental lymph nodes. Right now, we are only talking about anatomy. In the next session, I'm going to talk about the importance of the submental lymph nodes in understanding the midline swellings. Now we are done with hyoid bone. Let us come down a bit now at approximately at C4, C5 level. We have the thyroid cartilage. So this is thyroid cartilage. Thyroid cartilage is like two laminae. My one hand represents one laminae. This hand represents another laminae, and both the laminae will meet here in the center. That is the angle, which people usually call it as Adam's apple. So first let us label this as lamina of thyroid cartilage. This is lamina of thyroid cartilage, which will meet here, somewhere here in the center, in the midline, and this is called as Adam's apple, or we can also call it as laryngeal prominence. Laryngeal prominence. Also, I would want you to remember right now that on this thyroid lamina, there is a faint oblique line like this. So this is oblique line, which is present on the thyroid cartilage on each lamina. Now, what is the gap over here between the upper border of thyroid cartilage and the upper border of the hyoid bone? There is a membrane. This membrane is called as, so the name itself tells you actually it's between thyroid and hyoid. So this is called as thyrohyoid membrane. Thyrohyoid membrane. Now this membrane is important because it is pierced by two structures. I'll just show the piercing here. It is pierced by a very important internal laryngeal nerve. Don't forget this point. Internal laryngeal nerve and superior laryngeal vessels. So it is pierced by internal laryngeal nerve and superior laryngeal vessels. So I'll just bundle up this and label it over here. So it is internal laryngeal nerve, which pierces the thyrohyoid membrane, and we have superior laryngeal vessels. Superior laryngeal vessels. Now, once this is done, we'll come to the next cartilage over here, and that is a very important cartilage because it's a cartilage of larynx, of course. Thyroid cartilage is also a cartilage of larynx. So the next cartilage that we are able to observe here, this is cricoid cartilage. This is the level where larynx continues as trachea, pharynx continues as esophagus. So we label this cartilage as cricoid cartilage. This is the next cartilage. Now, between cricoid and the thyroid, there is a fibroelastic structure in the midline. This is called as conus elasticus. Conus elasticus, or you can just call it as cricothyroid ligament. On either side of the same, there is a muscle right now. If I'm able to increase the pitch, the muscle is cricothyroid muscle. It's a tensor of our larynx. Don't miss this muscle. Clinically, very important. Anatomically, from exam point of view, very important muscle. This is the muscle which is the tensor of your larynx. So this muscle is cricothyroid muscle. Now, as we mentioned, cricoid cartilage is a very important landmark which lies at the level of C6 vertebrae. After the cricoid starts the tracheal rings, which has got around 15 to 20 tracheal rings, but here we are more concerned to draw at least 5 to 6. These are the tracheal rings. So we'll just label this as tracheal rings. Now, right in front of second to fourth tracheal ring, we have the very important gland, that is our thyroid gland. So the isthmus of the thyroid gland lies against second to fourth tracheal ring. This is extremely important to remember when you do tracheostomy. So this is the isthmus. Isthmus means a constricted part. So this is isthmus of the thyroid gland, and what I'm drawing now, this is the lobe of the thyroid gland. Thyroid gland has 2 lateral lobes. So this is how they extend upwards. So this is the lobe of the thyroid gland. So we have drawn the lobes of the thyroid gland. So isthmus and lobes of the thyroid gland comes next. So let us label this as isthmus. This is isthmus, and these are the lateral lobes. Lateral lobes of thyroid gland. Thyroid gland. Now, just beneath the isthmus of the thyroid gland, we have here a very important vein which I am drawing here. This is inferior thyroid vein. We need to keep all these points in mind during tracheostomy. So this is inferior thyroid vein. The last point that we need to understand is, on either side of the midline, we have 2 veins over here. I'm just drawing it on either side of the midline here. These are anterior jugular veins. These are anterior jugular veins. Actually, they just open into external jugular veins by, just turning laterally, but they also form the jugular venous arch over here. They also form the jugular venous arch. So let me label these veins as anterior jugular veins. And this arch is jugular venous arch. And then, of course, comes the last bony landmark, that is your jugular notch. So, these are the midline structures from symphysis menti to the jugular notch, and this is just plain anatomy. In the next session, we shall discuss about the clinical correlations. Why are we studying the midline structures? Thank you for watching. Please share your valuable comment for me to improve my class. Thank you so much.